My name is Cassie. I'm a speech language pathologist and I work in inpatient rehab. As a speech language pathologist, I work on speech, language, cognitive, and swallowing disorders. I mostly see patients who have had some sort of neurological issue, so damage to the brain, a stroke, something like that. So I'm part of the inpatient rehab team. So we meet every day. I work and talk with the doctors, physical therapists, occupational therapists. We all work together to make our plan for the patient. My favorite part of my job is making connections with the people we serve. In inpatient rehab, we get to see people every 5 days a week for about an hour apiece, and that gives us a lot of time to spend with our patients, so we get the chance to build relationships and really support them through this time of transition.
My name is Samantha Mitchell, and I'm a physical therapy assistant here at CarolinaEast Rehab. It is my job to follow the plan of care set in motion by the physical therapist to help regain functional mobility for our patients. It is our job as the department to get patients independent and back into the community with as much independence as possible so they can go home and get back to their normal life, usually after injuries or surgeries or prolonged illnesses. The most rewarding thing about my job is watching patients that come in and are unable to do things for themselves or unable to mobilize independently, and then they walk out the doors and they're able to get back to their daily lives and act like nothing ever happened.
I'm Meredith Garmon, RN2 in the rehab department. My job entails admitting the patient once they come from the acute care setting. We do admissions, we do assessments, we give out medications, we keep the doctor abreast of what's going on with the patient. My job is rewarding because I get to see the patient at their worst when they come to rehab. Myself, along with the rehab team, we help the patient set their goals, and then on the end, hopefully they have met that goal. And it's rewarding to see the patient come in, not able to walk, talk, or move in their regular manner. And then when they leave, it's like a brand new person.
I'm Karen Stepankis. My home is actually rehab. This is where I'm based out of. But I am all over the hospital, anywhere from the cancer center, ED, and all the units. So we are responsible for seeing all the patients that we are consulted for. It is woundostomy continence nurse, and that is WOCN for short. It's much easier to say. And a lot of people call us walk-ins. Sounds like something on Star Trek, but anyway. But yes, that is our official title. We were certified. There are two of us, my coworker Holly Thornton, and we both attended Emory for our training. And we have to sit for boards for these, of course, in all three areas, in wound, ostomy, and continence. And we have to pass those boards, of course, to become certified. So we are consulted either by physicians or nurses to see a patient that will have a wound, of diabetic wound, surgical wound, just about anything they come in here with. They will consult us. We usually get the consults, a lot of them are starting now in the ED. And we also see ostomy patients, and if there's any, our continence is mostly related to the wounds too, because of continence we get these wounds. But the ostomy part, we work very close with our surgeons, our general surgeons. And so we do ostomy training. So we manage wounds, we make our recommendations when we see the patient. And we work pretty closely with a lot of the disciplines, especially surgery and our vascular and dietetic, because all of that comes together to get our wounds to heal. And the ostomies, of course, we train the patients once they have this ostomy. After surgery, there's a lot that goes into that. There's a training that goes in with that. We want to make the patient independent, so we want to work with the patient, but we also want to work with a family member to help them out. It's an emotional time. We have that comes with a big psychological part of it, and so we work with that. We spend a lot of time with them just getting them through that. And we also offer our ostomy support group, which is very helpful to get through that psychological part of having to wear a bag. It's very, very difficult for patients, as it would be for anyone. So of course, getting to see these wounds to heal, we feel wonderful about that. The patients are happy. But I would say the most rewarding, and I was actually surprised, I went into this because I love wounds and I love doing wound care. The ostomy, I was kind of, I'm not so sure. But it is by far the most rewarding, because when we have patients that will not leave their house, they're, because of leakage, afraid of going out. I mean, this is something that is very personal, our hygiene. And so when we fix that, and we do fix it, when we fix that, that patient, the look on their face and the sound of their voice, and it is wonderful, and it's very rewarding that we got that. And they're so appreciative because they get their life back. They get to do the things they enjoy. And that's something that means a lot. That, to me, and that's the most rewarding part, is being able to help our ostomy patients and not to be afraid to get back into their lifestyle, what they were doing prior to their surgery.